Hello, distinguished gentlemen. Each night, when you close your eyes and drift off to sleep, you probably believe it is the time when your body rests and recovers after a long day. But there is a truth that few people know, and that is the way you sleep can silently affect the health of your brain, even increasing the risk of stroke without you ever realizing it. I am a brain specialist doctor. Through many years of work, I have realized that not all strokes come from aging or underlying conditions such as high blood pressure or diabetes. Sometimes, the culprit comes from a habit that seems harmless, the wrong sleeping position that you maintain every night for many years. The danger here is that you cannot feel this change immediately. Each night, the blood flow to your brain is slightly restricted, creating tiny damages that gradually build up over time. Then, one day, just a small incident is enough to trigger the consequences to erupt into a serious stroke. According to a study at Harvard University, just one common sleeping position can increase the risk of stroke by up to 73%, especially in people over 60. What is even more frightening is that 99% of older adults still believe that this position is harmless, even thinking it is good for their health. That is why in today's video, I will share with you the dangerous sleeping positions you need to avoid, explain the mechanisms behind them, and show you how to adjust to protect your brain. And I believe you will be surprised by the first position because this is the position that so many people love and use every single night. But before diving into the main content, I would like to get to know you. Where are you watching this video from? Please leave a comment below because I will be very happy to know who I am accompanying on this journey. And right now, let's begin exploring the first dangerous sleeping position. This is the position that many people think is harmless, but in reality, it can silently constrict the brain's blood vessels every single night. Position 1. Sleeping on your back with one arm under the pillow, a hidden danger for blood vessels and the brain. Sleeping on your back is often considered one of the healthiest resting positions. However, when you place one arm under the pillow, a habit that seems small and insignificant, everything changes. In this position, most of your body weight, which can be more than 60-90 kilograms, presses down unevenly, creating what is called asymmetric pressure distribution. This leads to the blood vessels in your arm being compressed for many hours continuously, especially the subclavian artery, which supplies blood not only to the arm, but also affects the blood flow from the chest to the brain. When the artery is tightly compressed, blood flow becomes turbulent, creating the perfect condition for blood clots to form, one of the leading risk factors for strokes. A 5-year study conducted at Johns Hopkins followed 200 adults who regularly slept in this position. The results showed that those who slept with one arm under the pillow had a 21% higher rate of transient ischemic attacks, TIAs. These are mini strokes, but are often the first step toward more severe strokes later on. This phenomenon becomes even more dangerous as we get older. Over time, blood vessels gradually lose their elasticity, like an old water hose that is no longer flexible. If they continue to be compressed in the wrong position, these vessels are more easily damaged, and at that point, the risk of stroke increases alarmingly, especially in people over 60. I still remember the case of Jennifer, a 58-year-old teacher. She had been sleeping with her right arm under the pillow for nearly 20 years. One morning, she woke up with her hand feeling weak and uncoordinated. At first, she thought it was just normal numbness, but after several hours without improvement, she went to get checked. The MRI results showed signs of multiple small past TIAs that she had never noticed before. The good news is that after changing her sleeping position by using a properly thick memory foam pillow, Jennifer no longer needed to place her arm under the pillow. We also helped her with a wedge pillow to slightly elevate her upper body and reduce pressure on her arm. After 6 months of consistency, not only did her morning headaches disappear, but the follow-up MRI also showed no new brain damage. And if you think this position is concerning, the next one directly affects the carotid arteries, the vital highways carrying blood to the brain. My dear friend, if you are still watching the video up to this point, I am very happy because it means you truly care about your health. Please leave the number 1 below in the comments so I know you are still here with me. Position 2. Sleeping on your stomach with your head turned to one side. Dangerous pressure on the carotid arteries. Sleeping on your stomach is a common habit for many people because pressing closely against the mattress brings a sense of comfort and relaxation. However, from a neurological perspective, this position raises serious concerns because of the silent damage it can cause to the brain's circulatory system. When you sleep on your stomach to be able to breathe, Your head must be turned completely to one side and kept there for many hours while you sleep. This causes the neck to be tightly twisted to one side, putting significant pressure on the cervical spine and especially on the two carotid arteries, the blood highways delivering oxygen and nutrients to the brain. In this prolonged, twisted position, one carotid artery is overstretched while the other is compressed against the cervical bones. The result is a substantial impact on the blood flow to the brain. A notable study from the University of Michigan surveyed 2,000 adults and found that those who frequently slept on their stomachs had a 33% higher incidence of carotid artery plaque compared to those who slept in other positions. Using vascular ultrasound technology, the researchers observed that the artery walls of stomach sleepers thickened earlier than their actual age, a sign of premature vascular aging. Moreover, among stroke patients under 50 years old, up to 78% were recorded as having a long-term habit of sleeping on their stomachs. This clearly shows the connection between this sleeping position and cerebrovascular events. I once treated Robert, a 45-year-old software engineer who always believed he was healthy and not at risk. However, he came to see me because of sudden flashes of light in his vision, a symptom indicating temporary retinal ischemia, also known as transient vision loss. The ultrasound results revealed that his left carotid artery, the side he always turned his face to while sleeping, had significantly narrowed. After evaluation, we applied interventions to change his sleeping position, including using a neck support pillow to keep his head straight and combining it with a body pillow to prevent him from rolling back into the stomach position. Adjusting wasn't easy, but after 3 months, his visual symptoms completely resolved, and the carotid blood flow showed signs of recovery. This position becomes especially dangerous for people over 50 when the artery walls naturally lose their elasticity. The repeated compression and twisting over many years create microtears in the inner lining of the arteries. These tiny injuries become collection points for blood fats, calcium, and cellular debris, forming dangerous plaques. Once a plaque breaks loose, even a tiny fragment is enough to block a brain blood vessel, leading to a stroke. And if you think sleeping on your stomach only affects one side of the carotid artery, the next position creates compression from both sides, leaving the brain in a state of intermittent oxygen deprivation without you ever knowing it. Position 3. Sleeping on your side with your arm under your head. The familiar cuddle that secretly risks brain circulation. This is probably one of the most common sleeping positions in the world. Lying on your side with your arm under your head or wrapped tightly around the pillow, a position many people find warm, cozy, and even helps them fall asleep faster. But behind that comfort hides a danger few people realize: the compression of vital blood vessels and nerves. When you use your own arm to support your head all night, you are unintentionally putting pressure on a sensitive area, the thoracic outlet, where important nerves and blood vessels travel from the chest to the brain and arm. When sustained pressure occurs over a long period, not only does the arm suffer numbness or reduced blood flow, but the brain's blood supply can also be indirectly affected. A study at Stanford University used special devices to track blood flow and brain oxygen during sleep in 900 people, and the results were striking. Those who slept in this position experienced an average of 43 episodes of reduced brain blood flow each night, each episode lasting from 30 seconds to 3 minutes. That means throughout the night, the brain endures nearly 2 hours of repeated mild oxygen deprivation, which, when accumulated over time, can damage brain tissue. In particular, MRI scans of people who maintained this position for more than 15 years showed the presence of white matter lesions, a common sign seen in individuals beginning to experience memory decline. This is no longer just about morning numbness or shoulder pain, but a clear indication that the brain structure itself has been affected. I once treated Maria, a 62-year-old nurse who lived a very disciplined and health-conscious lifestyle. She came to me because recently she had been forgetting simple words or having trouble expressing herself. The MRI results revealed multiple areas of white matter damage, and the striking thing was that she had no significant medical history except for one habit: sleeping on her side with her head resting on her left arm for over 40 years. We started by changing her pillow, using a specially designed side sleeper pillow with a proper contour so her head didn't need to rest on her arm. She also learned to slightly rotate her body into a quarter-turn position, allowing her weight to be evenly distributed across her shoulder and torso rather than pressing directly on the lower shoulder. At first, it took her a few weeks to adapt, but after 6 months, her memory and reflexes improved significantly. And more importantly, follow-up MRI scans showed no new brain damage. Sleeping on your side isn't the problem. The issue lies in how we support the head and shoulder while lying on the side. If the third position mainly reduces blood flow to the brain silently, the next position involves a full body twist, creating circulatory chaos that no one would expect. If you are still watching this video up to this point, thank you for patiently listening until now. I truly appreciate it. Please leave the number 3 below in the comments so I know I am not talking to myself. Position 4. Twisting the body while sleeping. The twisted posture that disrupts cerebral circulation. There is a type of posture that many people cannot name precisely, yet they often sleep in it. The upper body turns one way, while the lower body, usually with one leg, crosses to the opposite direction. At first glance, it feels comfortable because it creates a sense of muscle stretch and reduces back pain. But for neurology professionals, this posture is a kind of dangerous twist, often called the twisted pretzel. The problem lies in prolonged, asymmetrical twisting of the spine, where the vertebral arteries are housed, which are responsible for supplying about 20% of blood flow to the brain, especially to important regions, such as the cerebellum and brainstem. When the spine is twisted for many hours, these arteries are not only compressed, but also bent, causing the blood inside to become turbulent and creating areas of stasis where blood clots can silently form. An in-depth 2023 UCLA study used modern imaging techniques to track actual blood flow through the vertebral arteries during sleep. The results showed that in people who slept in the twisted posture above, vertebral artery blood flow decreased on average by up to 67% throughout the night. Even in the group over 55, nearly half of the participants developed microthrombi, tiny clots that can travel to the brain and cause stroke. One detail that truly surprised doctors is that the stroke rate in the group with the habit of sleeping twisted was nearly 5 times higher than in the group sleeping in proper alignment. And most of these strokes did not manifest dramatically, but occurred silently, only detected on brain MRI when vague symptoms like loss of balance, slurred speech, or visual disturbances appeared. I once admitted a patient named Thomas, a healthy man with no history of heart disease or hypertension, who was hospitalized due to sudden left-sided weakness and difficulty speaking. The MRI showed he had a stroke in the posterior circulation, exactly where the vertebral arteries supply. After carefully investigating his habits, we discovered he had slept in a twisted posture for 10 years since a back injury. To improve the situation, we combined several solutions, using a pillow between the knees to keep the hips aligned, placing a thin towel under the lower back to prevent twisting, and especially treating the back pain thoroughly with physical therapy. Thanks to that coordinated approach, Thomas recovered significant function after the stroke and, most importantly, no longer slept in a twisted posture. This posture is often underestimated because it does not cause obvious discomfort right away, but in reality it is bending the blood vessels every night. And each such night is a time when the brain is threatened in silence. And there is one last posture, which seems to be the safest and most comfortable sleeping position. But when done incorrectly, it becomes the most dangerous posture I have ever witnessed throughout my career treating brain disorders. Position 5. Curling up in the fetal position, when the chin touches the chest and blood flow to the brain is blocked in both directions. The fetal position, with a rounded back, bent legs, and the head lowered, often evokes a sense of safety and being embraced, especially for those who are sensitive or under psychological stress. But when this posture is maintained too tightly, especially when the chin is pressed close to the chest, it not only curves the spine but also causes a series of serious problems related to blood flow up to and down from the brain. What many people do not notice is that in such a deep flexed posture, the carotid arteries, which deliver 80% of the blood supply to the brain, are compressed from both sides, while the jugular veins, the pathway that carries venous blood from the brain back to the heart, are simultaneously obstructed. This creates a dangerous situation. Blood going to the brain is reduced, and blood leaving the brain is also impeded. This condition increases intracranial pressure, forcing the brain to fight to maintain the amount of blood needed for cellular survival. A 7-year Harvard study monitored nearly 2,400 older adults and found that those who frequently slept with a tightly tucked chin experienced on average more than 100 episodes per night of significant cerebral blood flow reduction, enough to damage critical brain tissues if repeated nightly over many years. Brain scans of people who maintained this posture for a long time showed typical signs of chronic cerebral hypoperfusion, including areas of decreased tissue density, white matter damage, and a more than tenfold increase in stroke risk compared with the control group. One case that left me with much regret was Mr. David, a 68-year-old retired accountant who always considered himself healthy but often slept tightly curled due to a habit from his youth. His wife had noticed he often gasped during sleep and that his face occasionally turned pale. But only when he woke up with hemiparesis and slurred speech did they truly understand the seriousness of that habit. Magnetic resonance imaging showed not just one, but dozens of signs of small past strokes that no one had recognized. We had to implement comprehensive interventions, using a specialized nighttime cervical collar to prevent chin flexion, switching to a large C-shaped body pillow to help him maintain a comfortable posture without overcurling, and providing psychological counseling to control anxiety, the invisible factor that triggered the reflex of curling during sleep. The results after many months were not only recovery of motor function, but also more stable, deeper sleep, and subsequent brain imaging showed no new lesions. Although each wrong posture accounts for only a few hours in a night over thousands of consecutive nights, the silent cumulative effects will become a major problem. And when it comes to sleep, which occupies 1/3 of life, choosing the right posture is not just a habit, but a life or death decision for brain health. Right after this, I will share with you the posture that neurologists rate as the safest for people over 60, a posture that can help prevent stroke, improve cerebral circulation, and bring better quality sleep every night. Part 2. The optimal posture to help prevent stroke. Lying on your back, slightly elevating the upper body, and keeping the neck aligned. After discussing 5 postures that can silently damage the brain, many people will ask, so is there a way to sleep that is both safe and helps blood flow to the brain circulate easily? The answer is yes, and the solution is not as complicated as you think. Modern neurological research shows that the best sleeping posture to optimize cerebral circulation is to lie on your back with the upper body slightly elevated from 15 to 30 degrees. This posture is called circulatory neutral by specialists, meaning it does not kink blood vessels, does not put pressure on major flow pathways, and does not obstruct blood going to or leaving the brain. The main reason is that when you lie straight, with the head slightly elevated, the neck not flexed, and the chin not dropping to the chest, the carotid and vertebral arteries maintain their natural shape, thereby allowing blood to reach the brain more smoothly, thanks to a gentle assist from gravity. At the same time, the jugular veins are also unobstructed, helping CO2-rich blood and waste from the brain easily return to the heart for cleansing. Some clinical trials have recorded that simply sleeping in this correct posture can reduce stroke risk by up to 43% compared with commonly incorrect positions. However, to maintain the correct posture throughout the night, lying on your back alone is not enough. You need some appropriate support tools, a neck pillow that matches the natural cervical curve, not pushing the head forward or overextending it, a wedge pillow or an adjustable bed that can slightly elevate the back, helping you avoid sliding down during sleep. A thin pillow under the knees will also help reduce pressure on the lumbar spine and keep the body stable. For those who are used to side sleeping or turning during the night, you can start by staying in this posture for about the first 20-30 minutes, then gradually extend the adaptation time each night. Many people share that after about 2 weeks, the body begins to get used to the new sensation, and sleep quality improves markedly. Beyond the benefits related to cerebral blood vessels, this posture also helps reduce snoring, improve breathing, reduce the risk of acid reflux, and support the treatment of sleep apnea, factors closely related to stroke in older adults. So now you know 5 postures to avoid and 1 posture to adopt to protect the brain during sleep. But is adjusting your sleeping posture alone enough to reduce stroke risk? In the next part, I will help you discover the pre-sleep habits, from diet and lighting to when to turn off the phone, that can silently affect blood vessels and the brain every night. Part 3. Pre-sleep habits, the silent factors that disrupt cerebral circulation. Many people think that just lying in the correct posture is enough to rest throughout the night, but in reality, what you do in the 60 to 90 minutes before bedtime can directly affect the quality of cerebral blood flow while you sleep. And many of these are familiar habits, or even things thought to be beneficial, that are quietly increasing the risk of circulatory disturbances and stroke. First, eating dinner too late or too high in fat before bedtime can force the body to increase blood flow to support digestion while you are resting. This diverts the blood needed for the brain, especially during the early stages of deep sleep, a critical time for brain recovery. In addition, if you lie in an incorrect posture after a greasy meal, The risk of acid reflux also disrupts sleep and indirectly affects brain oxygen. Second, using electronic devices with blue light right before bed not only suppresses melatonin, the hormone that regulates sleep, but also stimulates the sympathetic nervous system, keeping blood pressure and heart rate higher than normal. This means that the brain's blood vessels have to work more tensely when you should actually be transitioning into full rest. A study from the National Institute of Neurology showed that people who used phones or tablets within 30 minutes before bedtime had a 27% higher risk of cerebral circulatory disturbance than the group that turned off devices earlier. Blood flow in regions such as the prefrontal cortex, which is responsible for language coordination, short-term memory, and emotional control, was clearly affected when measured by fMRI. Third, ignoring mild stress signals before sleep, such as low-grade anxiety, ruminative thoughts, or a mildly elevated heart rate, can also contribute to increased intracranial pressure and blood pressure variability during sleep. If these changes occur frequently, they increase the risk of forming microthrombi in the brain's capillaries. Therefore, for sleep to truly be a time of healing for the brain, experts recommend have dinner at least 2-3 hours before bedtime, prioritizing easy-to-digest foods with low saturated fat. Stop using electronic devices at least 45 minutes before sleeping, replacing them with warm, yellow lighting or reading paper books. Practice gentle relaxation techniques such as deep breathing, journaling, or listening to slow-wave music to guide the body and vascular system into the calmest state. Sleep is an opportunity for the brain to recover, but only if you do not accidentally disturb your own circulatory system before you lie down. And if you truly want to help your brain stay younger and more agile, then in the next part, I will share with you some silent signs that cerebral circulation is in trouble, early signals that can be recognized before a real stroke occurs. Part 4. Early warning signs. The body speaks up before a stroke happens. In reality, it is very rare for a stroke to occur completely unexpectedly. Our bodies, especially the brain, often send out many small warning signals repeatedly, but they are often overlooked or mistaken for vague symptoms of fatigue or stress. One of the most common early signs is a feeling of numbness or weakness on one side of the body, especially in the arm, leg, or facial area. These sensations may last only a few minutes and even just a few seconds, but if they recur over several days, they may be a manifestation of a transient ischemic attack, TIA, a kind of mini-stroke, but a clear warning of a real stroke that is about to occur. Another symptom that is often underestimated is sudden loss of balance or lightheadedness when standing up, even when there is no obvious change in blood pressure. This happens when blood flow to the brain is not fast enough, often due to arterial narrowing or disordered flow. If this phenomenon is accompanied by blurred vision, seeing stars, or a spinning sensation, special attention is needed. In addition, temporary language disturbances, such as suddenly being unable to find words, slurred speech, or forgetting a familiar sentence, are also common warning signs. Many people assume they are just too tired or sleep deprived, but in fact, the brain is having difficulty maintaining the flow of oxygen and glucose, the two vital elements for neural activity. A meta-analysis from major neurology hospitals in the United States showed that more than 62% of stroke patients experienced at least one clear warning sign within 7 days before the stroke, but only 1 in 5 sought a doctor in time. Therefore, if you often experience numbness in one arm or leg upon waking, lightheadedness each time you stand up, brief disorientation, stuttering, or difficulty expressing yourself even though your mind is clear, do not ignore it. These are not simply transient reactions, but may be the result of many nights of insufficient blood flow to the brain, causing nerve cells to be repeatedly damaged little by little. Early detection of these signs is the key to preventing stroke, and sometimes just changing a few daily habits can significantly reduce the risk. However, there is a factor that few people consider, but that strongly affects blood flow to the brain. That is the neck posture when using the phone, reading, or even when working every day. In the next part, I will share with you an astonishing truth about head-neck posture and how it affects stroke risk in people over 60. Part 5. Head-neck posture. Unconscious habits that directly affect blood flow to the brain. We often think stroke is the result of big factors, underlying disease, age, blood pressure. But sometimes a repeatedly incorrect neck posture in daily activities, when looking at the phone, working at a screen, or reading in bed, can also silently but persistently disrupt the blood flow that nourishes the brain. The problem lies in the cervical vertebral arteries, blood vessels that run along both sides of the cervical spine, responsible for supplying blood to the cerebellum, brainstem, and the centers that control balance, respiration, and circulation. When you bend your head forward for too long, especially when using a phone or a low-place laptop, these arteries are stretched and pressed against the bony structures and soft tissues of the neck. As a result, blood flow becomes disordered and slows down, especially when the deep forward bent posture is maintained for many hours each day. A study published in the American Journal of Spine and Neurosurgery indicated that when the head is bent forward about 60 degrees, the posture common when using a phone, the force on the cervical spine increases fivefold compared to a head-neutral posture. This not only causes cervical disc degeneration, but also directly affects the pressure and pathway of the vertebral arteries. In an experiment at a U.S. multidisciplinary medical center, experts used Doppler ultrasound to measure vertebral artery blood flow at different head positions. The results showed that when participants bent their heads forward more than 45 degrees for 20 minutes, blood flow decreased by an average of 38%, accompanied by mild symptoms such as lightheadedness, neck fatigue, and blurred vision. In older adults, this problem becomes even more serious due to the aging of connective tissues and the natural narrowing of the vessel lumen. A daily repeated incorrect neck bent posture can be the factor that silently disrupts cerebral circulation, especially when combined with improper sleeping postures or other unfavorable lifestyle habits. The good news is that adjusting neck posture is entirely feasible. Start with small steps. Raise your phone to eye level instead of looking down. Use a laptop stand or monitor set at eye level. When reading, use a support pillow or a slanted desk instead of reading while lying down. Perform gentle neck stretches, deep breathing, and light rotations of the neck-shoulder nape every 1 to 2 hours while working. Remember that the brain has no blood reserve, and any disruption, however small, if repeated, will leave cumulative consequences. And if you are worried about whether you have changed enough, in the next part, I will share a simple at-home test to help you self-assess the risk of disordered cerebral blood flow. It takes only a few minutes, but can give you timely warnings to adjust early. Part 6. A simple at-home test. Early detection of cerebral circulation disorders. One of the most concerning aspects of cerebral circulatory disorders is that they often progress silently. No pain, no fever, no clear signs until a stroke or memory loss occurs. But fortunately, you can perform several simple tests at home to identify potential abnormalities before it is too late. One of the tests commonly used by specialists in clinical practice is the classic test for the vertebral arteries, also known as the head rotation test. Observe visual responses. Although it cannot replace modern medical techniques such as Doppler ultrasound or MRI, this method still has value in early screening for posterior circulation disorders. The implementation is very simple. Step 1. Sit upright on a chair, keeping your neck in a neutral position. Step 2. Slowly turn your head to the left as far as you can without moving your shoulders. Step 3. Keep this position for 10 to 15 seconds, focusing on how your body feels. Step 4. Return to the starting position, rest for a few seconds, then repeat the same to the right. What to note is that any symptom appearing while turning your head or immediately afterward may indicate that blood flow through the vertebral arteries is being affected. The signs include a feeling of lightheadedness or dimming vision, blurred vision or the appearance of flashing spots, ringing in the ears, mild nausea, brief loss of balance, numbness in the nape or shoulder area. If you experience one or more of the above symptoms during the test, it does not mean you definitely have a disease, but it is a reminder that cerebral blood flow may be having problems, especially if you often have incorrect head-neck postures or possess other vascular risk factors. Another test also used in neurology clinics is the arm elevation test to check postures that compress blood vessels and nerves in the upper chest, often related to thoracic outlet syndrome, which indirectly affects cerebral circulation. Raise both arms high and bend the elbows to form a right angle as if pretending to surrender. Hold this position for 1 minute. If you feel hand numbness, unusually rapid arm fatigue, a cold sensation, or loss of sensation, that may be an early sign of circulatory disorder in the chest-shoulder region, affecting blood flow to the brain. Both tests do not replace an official medical diagnosis, but if performed and symptoms recur, you should proactively see a specialist for more in-depth evaluation. Understanding your body is the first step to controlling your health. And in the next part, I will share with you a 7-day plan to improve cerebral circulation, including posture changes, habits, and nutrition, designed specifically for people over 60 who want to prevent stroke naturally and sustainably. Part 7, 7 days to improve blood flow to the brain for people over 60. A natural, simple, yet effective recovery plan. Not all damage within the cerebral circulatory system is irreversible. In fact, many studies have shown that with just 1 week of lifestyle adjustments, people over 60 can feel a noticeable difference in clarity, balance, sleep, and concentration. The key is to have a specific strategy, small steps, but in the right direction. Below is a 7-day plan to improve cerebral blood flow, combining posture, gentle movement, breathing, and nutrition, especially suitable for older adults. Days 1-2, rebuild resting posture and practice. Deep breathing. Spend at least 15 to 20 minutes at the end of the day lying on your back with your head elevated 15-30 degrees using a wedge pillow or back support pillow. Combine with diaphragmatic deep breathing exercises. Inhale slowly through the nose for 4 seconds, hold for 2 seconds, exhale through the mouth for 6 seconds. Repeat 10 times in the morning and evening. The goal is to improve blood, oxygen levels, and reduce pressure on cerebral vessels during sleep. Days 3-4. Activate circulation in the neck-shoulder nape region. Perform light neck exercises twice a day. Slow neck circles, tilting the head left-right, gentle extension flexion. Avoid any activity that makes you bend your head for too long. Use a phone stand or position the screen at eye level. Combine with gentle self-massage or a warm towel on the nape neck area after dinner. Days 5-6. Adjust nutrition and dinner timing. Have dinner at least 2.5 hours before bedtime. Prioritize easy-to-digest foods, low in salt and saturated fat. Add brain vessel supporting foods such as salmon, eggs, walnuts, spinach, turmeric, blueberries, and fresh ginger. Drink enough plain water. Do not replace with carbonated drinks or sugary beverages. Limit drinking large amounts right before bed to avoid nighttime awakenings. Day 7. Synchronize sleep and mental state. Turn off electronic devices at least 60 minutes before sleep. Spend time reading, listening to soft music, or writing a few lines of gratitude in a journal. Use warm yellow lighting in the bedroom to signal safety to the brain. If possible, meditate quietly for 5 minutes before sleeping. Simply focus on your breath and feel each muscle group relaxing. The essence of this plan is not to create instant change, but to reopen natural circulation channels that have been blocked by years of incorrect habits. When practiced consistently, most people feel a lighter head, deeper sleep, and noticeably improved memory after a week. However, if you truly want to maintain long-term results, 7 days is only the starting point. In the final part, I will share with you long-term, sustainable, and safe habits to protect the brain's vascular system after age 60, not only to prevent stroke, but also to preserve clarity for the years ahead. My dear friend, the health of the brain does not depend only on medication or complex medical interventions. It begins with the small things we repeat every day, like sleeping posture, how you sit at work, when you eat dinner, or even whether you spend a few minutes to breathe correctly. I hope the sharing in today's video has helped you re-examine habits that seem harmless, but can directly affect the blood flow that nourishes the brain, the place that stores our memories, emotions, and life itself. If you find this video useful, do not forget to click like, subscribe to the channel, and turn on the notification bell so you do not miss the next videos about health after 60. And if you have any questions or experiences to share, I am always ready to listen in the comments below. Wishing you a clear mind, deep sleep, and a body full of vitality. See you in the next video.